And just a little correction. I hope I'm audible.
Yes, yes, you are.
Okay. Just a little correction. I'm not a psychiatrist. I'm a physiatrist. I'm a rehab physician.
Yeah.
So this terminology is a bit new in Pakistan. So it will take a while for people to get acquainted with this word. So I know how the last lecture is. Everybody anxiously waits for the last lecture to end. So I'll quickly scroll through, and I'm grateful to my other colleagues for mentioning many things beforehand so that I could skip quite a few of the slides. So let's start. Okay. So I don't know how to handle slides on my behalf at my end. So I'll just say next. So if you could just control on my behalf, I'll be really grateful. So this is the only civilian institute in Pakistan which caters to all kind of physical, cognitive, and mental impairments and disabilities. I'll not go into challenges which our Down syndrome children are facing because my colleagues have already highlighted it. So we go over to the next slide. Okay, so here I will pay stress on that it's not a one-man show treating or managing a Down syndrome. It's a multidisciplinary rehab team, which involves, of course, uh, uh, first of all, awareness among parents of Down syndrome, then the multidisciplinary team assessment and management, and third is inclusion of this child in educational system, society, community. So this whole process is called a rehabilitation. So we go on over to the next slide. So at our institute, the multidisciplinary team, they work together. And part of the team, and it revolves around the child with Down syndrome. Physiatrist or a rehab physician, we take into loop a pediatric neurologist, a developmental pediatrician, physiotherapist, psychiatrist, neuropsychologist, occupational therapist, language and swallowing therapist, social worker, recreational therapists, vocational, and so on. We make a whole team. We are lucky that we have a team under one umbrella. So as soon as the child walks in after assessment, we prepare an individual tailored program for the child. And we take care of few things in that program which we should be really aware of, that they are visual learners. So you have to do pairing of pictures along with verbal commands. So say mostly rely on pictures and they are visual learners. They require simple directions and then allow adequate time for them to respond. And you have to break their therapy session into small sessions because you expect a slower rate of learning. But these children really do wonders. If you just follow the patterns and you're there, then you can just follow these rules and go on. Next. Okay, so next. So I'll just describe an individual uh, program of individual team member. Me as a rehab physician, when they walk into my clinic, I assess them and I make a rehab plan for them. And that plan is implemented by my team. And then we monitor them once in 2 weeks. So these are my team members, and I'll just quickly highlight what do they do. So my occupational therapist just does work on their delayed milestones, their self-care skills, which are also called activities of daily living. They work on their fine and gross hand movements, bimanual coordination, their sensory, because their sensory, central and peripheral sensory system, they work and it's impaired. So they work on the central and peripheral sensory systems, perceptual motor symptoms, and their psychosocial functions through play activities. So these are few pictures. If you could quickly scroll them from my institute, where you could see Down syndrome children involving in sensory reintegration, vestibular simulation. This is peripheral sensory reintegration. This is their vestibular rehab, part of their vestibular rehab. And then we involve them in different kind of activities in order to channelize. This developing fine and hand motor skills. So this is shortly a role of an occupational therapist. Can I have a slide, one slide before this? Then the role of the physiotherapist comes. Yes, one slide. Just go beyond one slide. Yes. The role of physiotherapy with Down syndrome is that they develop their core stability, their mobility, their balance, coordination, and gait. So they work on their gross motor skills of walking and handling things. Next. Next. Neuropsychologist has a major role to play. We are lucky that we also have one in today's session. So my team of neuropsychologists, as mentioned by developmental pediatrician in the beginning, that they have their batteries, they'll tell us, they assess whether it's a Down syndrome and what's the level of cognitive, how to assess the cognitive functions, the intellectual functions, their behaviors. So we have different batteries. So the neuropsychologists, they give us those batteries and we know so that we can work on there. So to get them and our other team members, they work on their neuropsychological deficits. Our language and swallowing therapists, they provide oral motor function therapy so that any difficulty which a Down syndrome has with swallowing or language, they develop those. Next. Okay, so here are we. So then once all the team members, they work on a Down syndrome child, he's ready for the inclusion in community. So what are the benefits? So they, of course, they help recognize and they use the strength of the child so that they can function in the real world. So they teach kids about tolerance and how to accommodate with children, how to grow out the empathy, and and of course they help the child reach their personal maximum potential, which may be functional, physically or cognitively, psychologically, vocationally, and even educational wise. Okay, so these children, they learn all the skills which a normal child is prone to, and by different approaches when the team works with them all together. So we, together with England, we've developed, these are the group therapies which they do. These are few pictures of inclusive education classes. So we, as a institute, along with England, Brunel University, we developed our own cultural and religious friendly guide for inclusion for these children. Next. So this is a guide, and you're welcome to even next. You're welcome always to share it with us. So we developed our guidelines how to include these children in the community. Okay. I was asked that I should be talking about the challenges faced during COVID-19 because we had to switch over to online sessions. So I have, of course, me as a director of the institute, we have a Dropbox. So we wanted to know because this was a change in everybody's life. So I just had a question here for parents. That what were the pros and what were the cons during COVID-19 for them. So I've mentioned both. So pros were parents found that teletherapy was effective as they attended sessions online and they don't have to waste time going out. So they could attend it in their own comfort, in their own home. So which was fairly affordable for them because here back in our country, even transport is very expensive. So quite a few of them found it affordable and convenient. And mothers had time at home because they didn't waste enough time picking, dropping children and sitting with them. So they thought they had enough time to work on their activities of daily living through the rhymes, through educational videos, through online sessions given to them by therapists. So they could train their children easily for toilet training, feeding, eating, dressing. So they thought they could work more on the children during these COVID times. Uh, so I don't know, there's a blank now. There's a blank line coming. I don't know what it is. Okay. So parents found teletherapy encouraging when they have, you know, उनके अगर physical challenges के साथ उनके पास बच्चा, sorry, these are cons. I think pros are over. The pro slide is over, right? Can I have a pro slide? Okay. Can this strip be removed from the middle? Move this back. Yes. Thank you. So, uh, even parents found that children developed more social skills because they were at home with their family for a longer time. So they developed a good social and recreational skill indoors. Next. So now I'll be discussing few cons with you, which parents shared with me. And we also noticed. So COVID-19 disrupted the routines of children, which has even accelerated on the other hand, poor sleeping habits and overall impacted their physical as well as mental health. Because maa, baap, bache, everybody is awake for a longer time at night. So at times, mothers thus avoided video calls sessions as children were usually not up in the morning. They were not alert, and I mean they couldn't. And thus, most of the parents said that it has led to a very unhealthy lifestyle at home because nobody is following the routine. So even children started throwing tantrums because of this. And third, which parents found it very challenging, it that when they have a child with physical challenges, uh, Down syndrome child with physical challenges, it was difficult because therapists are trained and they knew how to perform exercises, how much force to exert, how to do. So they probably thought that their children behaved better with therapists rather than them. And um, yes, the next was that they were used to in-person therapy more, so it was difficult for parents to switch off. And most of the parents in our country in rural areas, because we cater to almost whole of our country, so it was hard for them to conduct online sessions because they had no access to internet or Android phone. Some parents have lot of distractions at home because mothers with so many children, so they couldn't manage to give at one time to one child at, and that also at screen. So these were few challenges, and the last one was that it's difficult for many, even, sorry, what was the last point? We just quickly changed the slide. There was one last point. Yes, it's difficult for some children to sit in front of the screen for longer time because they do have attention deficits. Next. So at times parents are casual that they would cancel the sessions क्योंकि उनको online मिल रहा था और इनके availability पे मिल रहा था. So at times I also found quite a few parents being casual कि can you cancel today's session, and because we have a family outing or we have to go. So these are just real time uh, problems, the positive and also the negative ones. Because at times, no matter how hard we tried, but parents just won't absorb uh, on the other side of the screen how to get over. So this is just an outline of one of the parents. Two parents wrote to me. So I have many emails. So I've just copied two of them with you. And then I would like to share, day before yesterday, I got these short videos uh, from one of the parents. So I thought it will take 2 minutes. It's a 10-second video. And according to her, she found a lot of improvement during COVID with a down baby, with a down child. So I'm just sharing with you to see that how mothers feel. So can we have these videos, please? So they felt happy. I mean, in fact, I get a lot of videos like this because we assess their ADLs by what they're doing at home. So I get a lot of videos. So few are not encouraging, but I would like to share all encouraging videos today. So few were not, but mostly children and parents were very happy to be home together in COVID times. And parents felt that they could train their children more easily at home, being together in the activities of daily living. So they felt that during COVID times, now they are more independent. Can we quickly scroll through all the videos? Each video is not more than uh, 10 seconds. So this is sort of their homework. So we expect parents every day to send us short videos so that we can see that what is the result of our online sessions. So I had plenty of those, but I thought I'll pick up just few. But I think one or more left. Or So here, before that, he never used to volunteer, but they say now he volunteers with his dad to help wash him his car. So these activities are quite encouraging. So with therapists online, advisors, they incorporate them at home. But at institute, we don't have so many, like in activities of daily living room, we are limited, but here children can also do their outdoor activities. So I think that's the end of the videos. And I think my last slide is just, or do we have one more video? I don't know. I don't think so. So that's it. My take-home message is that we all deserve to be part of community and no one deserves to be left behind. So thank you so much for your patience. I know it's really hard to listen to the last speaker, but I really appreciate your tolerance and attendance. Thank you so much.